Reading the reports is one side, but Malteser International wants to see the improvement and talk directly to the responsible people. Therefore, they visit one of the most successful health centers to see how effectively donors' money is spent. After a short briefing about the work of the health center and its positive developments, a long-held wish comes true. A motorbike for the extended outreach activities of the health center midwives is handed over. Now the health center staff can reach out more easily and even faster to the patients and pregnant women in remoter villages. What are in general the objectives of Malteser International in Cambodia? We want to improve the overall health situation for the Cambodian people, especially for mothers and children. First of all, this includes safe deliveries as well as intensive care after birth. Secondly, we also support the promotion of community-based health insurance. This will help to increase the access to health care even for the poorest part of society in remote areas. By these approaches, we intend to strengthen a sustainable development of the country. Infant mortality in this region is still high, and the lack of hygiene is only one part of the problem. Inadequate feeding practices after birth have high impact on the health of children. Many women don't breastfeed long enough, which leads to diseases like diarrhea, bacterial infections, and even diabetes, all serious illnesses that can lead to the child's death. To decrease child mortality, Malteser International, together with SCHRA and with the support of the German Federal Ministry of Cooperation and Development, continuously work to further the awareness of women on the importance of nutrition. The time of breastfeeding plays an important role and needs to be further increased, and their work already shows first significant signs of success.
Malteser International, ist einer dieser.
The Federal Ministry for Economic Cooperation and Development is supporting Malteser International with a small contribution, but it is highly efficient and produces good results. This is true. The introduction of community-based health insurances and the health promotion in the villages are directly helping the people. Yes, I agree, and such a small-scale social insurance is not easy to establish and comes with high launching costs. An advantage of this approach is that one can only establish these schemes by working closely with the communities. It helps to prevent them from unaffordable and unpredictable health expenses that may push them below the poverty line. Costs for health services are very high, and Cambodians pay up to 60% of health costs from their own pocket, which is a comparatively high amount compared to the other countries in the region. Transport costs play a major role as well, but all this can be addressed with a simple but sustainable approach in a pilot project that is realized with the help of the German Ministry for Economic Cooperation and Development. Rice alone cannot provide a balanced diet, since rice lacks essential vitamins. Since most people here are very poor and do not have access to fruits or vegetables in the market, Malteser International promotes home gardens. The home garden advisors come directly to the villages, help to set up the gardens, provide the first seeds, and consult the people during growth. They also regularly follow up in case problems occur. To secure survival, even the smallest members of the families have to help. School attendance is compulsory in Cambodia, but teachers often fail to attend or are not available at all. Due to the low government payment, teachers take up other jobs in order to guarantee a minimum income. Therefore, sometimes classes are cancelled, and on these days, children help their parents in the home gardens. Poverty can easily be seen through the type of house or its facilities and furnishings. Some thin sleeping mats, some cushions, no electricity and no running water. This shows a typical rural home in the vicinity of Samrong. Within this neighborhood, poverty is widespread. Therefore, families are willing to accept the idea of home gardens and thankfully start to grow their own vegetables. Both grandmother and grandchild are putting much effort into the growth of the vegetables. Here, survival comes first. It might not seem like an official office, but here health insurance is sold. The families have to pay between $2 and $3 per person. In each contract, the insurance covers all consultations and transport to the hospital. The health facilities are very interested in concluding a contract with the insurance provider, and thus benefit is insured all round. Such a contract guarantees part of the income of the health facility and at the same time secures the job of their staff. The system is only in its initial phases, but it does save lives and needs to be supported and further promoted. A contribution to this effort is made through the Martin Aid campaign of Malteser International. The Martin Aid campaign is based on the principle of Saint Martin, who shared with the poor without ever treating them dismissively. This is what we want to realize. We want to take his example, request the people to help and share with the poor in other parts of the world. We want to do this in the example of Saint Martin. This is where we want to introduce Liam. We want to give an example and show how people in other parts of the world live. By giving the campaign a face, we want to enable the people who donate their money to meet the people who receive their money thousands of kilometers away on an eye-to-eye basis. 10-year-old Liam arrives back from a bath in the local water pond accompanied by his grandmother and Noem. He feeds his bird and shows us where he sleeps. He spends most of his time with his grandmother to give her some company. But of course his parents also play an important role in Liam's life. When he has school holidays, Liam, just like other children, has to help his family in the home garden. Rice alone would not feed his family, as he has 4 more sisters and brothers. Helping to plant and grow vegetables and fruits is part of Liam's everyday life. Now he is back home and friends come by to visit. Before going to play with the other children, he has to fetch water for cooking from a well not far from his house. Now he has fulfilled all his duties and the 10-year-old boy is free to play with his friends in the compound of the house. Maybe the Martin Aid emblem on Liam's t-shirt encourages you to join the campaign and also become a volunteer of St. Martin.